All right. All right. Hello, everyone. Good afternoon. Welcome from Clearwater, Florida, and welcome to today's live podcast. I already see several of our attendees here. Participants are adding up pretty fast. So let's see. This is Daniele Lattanzi, co-owner and CEO of Union Nutritional System, and I have with me the pleasure to have our VP for BioPharma, Edward Acosta, and our Director of Clinical Training, Dr. Brad Christensen. So hello, everyone. So let's see, before we start let's give it a couple of minutes, but I would love to hear who is here with us. So let's see, tell your name, say hello to everybody, and from where you're coming from. I see here we have Bill Bender, Bill Eichnoff, Katrin Kranz, Debbie, Donna Meyers. Hello. Okay, so who else is here? And please write your name and where you're coming from. Okay, wow, we have lots and lots of people. I see Thomas, Shelley, Sharon, hello, Renee, Michelle, Michael Fuller, Marianne, and let's see, Lori Sullivan. Okay, so, woo, Debbie from Oregon. Lots of snow. Oh, wow. Okay. Kathleen, Langston, Glenn Rose, and Tom Barba all together. Wow. Okay, so that's good. Well, everyone, welcome. This is an awesome opportunity, a live podcast. It's great to see you, all of you, and very glad that you're here. And thank you very much for taking the time to be with us today. And so we are going to talk about very interesting things. And we have with us two amazing people that they're going to share all their knowledge about BioCell and these amazing products. So Edwards, so welcome. How are you today?
Good morning, Daniele. Good morning, Dr. Brad, and good morning to everybody that's tuned in. Hopefully, we can learn a little bit more about BioCell products and how we can implement them. And any questions you can have, I'd love to answer them. As always, I'm available to you guys and love joining the group.
Awesome. Appreciate it. So Edward, just a quick recap. So for people that doesn't know this process, can you give like a 1 minute history of BioPharma stem cell derivative and what this is all about?
Absolutely. BioPharma International is a distributor, but we mostly we distribute BioCell Ultravital to the group. BioCell Ultravital has over 80 years experience in cellular therapies, cellular renovation therapies. They started back in the mid 1900s with injectable forms of the product. And over time, we were able to develop these. And through innovation and research and development, we've gotten the current fourth generation that we use that's in oral form that helps stimulate cell potency and revitalization, regeneration, and help us all at a cellular level, which is the basics of our health.
That's amazing. So yeah, I mean, I believe that if I'm not wrong, like this BioPharma is one of the oldest, if not the oldest company that to deal with stem cell, right?
We trace back to Paul Nehans, which was the
Wow.
innovator of stem cell therapy.
Wow, amazing. All right, cool. So now, I guess, Dr. Brett, I think you most likely are this concept that is taught during the ACT that we actually talked about it in the past at this feeding versus seeding, right? Do you want to go over that concept for?
Yeah, just very briefly, because what In nutrition response testing, primarily what we're doing with all our products is we're just feeding cells that are low on energy or sick. So we just feed them something to get stronger. Whereas this product line that we're going to be discussing today is actually reseeding. So you can get younger cells because this whole thing has been derived from specially bred black sheep for this to have very young stem cell derivatives, and Edward's going to go over the difference between a stem cell and a stem cell derivative, and I'll let him take it over from there.
All right, all right. Edward, you want to go over that now, or you want to take it up later?
Stem cells that we use, it's just important to know that different products have different types of cells. The human ultracell, many people in the group shy away from it, and I think it's because of the understanding of what it is. These are pluripotent cells, which means these are cells from the cord, the umbilical cord, and they are extracted. They haven't functioned yet, so they're naive cells that can go anywhere in the body and do what's needed. That's why this is such a complete therapy. The rest of the products are specialized with extracted cells from embryos of certain organs or systems, and that's why they're more specialized, but they can't go in the body and do everything. And then later on, when we talk about the difference between the 3G and the 4G, we'll go into how we can stimulate mitochondrial function for energy sources in the cells, and the NAD component that we've added to these products.
Right, totally, totally. Now, when you were talking, just as a clarification, just so when you were talking about the complete product versus a specialized one, we're talking about the human ultracell is more of a complete package, right?
Absolutely. It's anti-aging because it revitalizes our cells and regenerates them to full capacity at any aspect of the body and any system of the body, versus cellular gain number 2 that might be more digestive and
Right.
will only concentrate on the digestive system. Another thing with human ultracell is we have that the mitochondria is stimulated. The mitochondria, if you go back to your biology, is the powerhouse for the cell. So we're energizing the cell so it can be at its most functional base. The easiest way to look at it is when we hit 30, our cells fend for themselves. So
Right.
we have billions of cells. As they start diminishing in capacity and waning away, we start aging. If we can potentialize those cells and activate them with human ultracell and our products, the theory is we can prevent aging and the aging process, and along the way, deter degenerative disease that are a consequence of this cellular aging.
Exactly. Wow, that's amazing. Yes, Dr. Brett.
Yeah, and that, we can definitely speak towards the anti-aging. Everybody knows that Dr. Ulin is now 80 years old. And back in the early 90s, he was almost dead. And at that time, he did a heart rate variability from Dr. Alexander Riptine. And Dr. Alexander Riptine age-placed Freddie at the age of 42. His body was functioning like a 90-year-old. When Freddie just turned 80, because of what Edward's going to be presenting with us, Freddie found this originally in an injectable form, and then we learned from Edward and his company that we could get it in pill form here in the United States. And Freddie started getting those injections. He had to travel a ways to get them outside the United States. And now at the age of 80, we just redid a heart graft on him. Same heart graft that he did back in the 90s. We age placed him, and now at 80 years old, his body's functioning like a 50-year-old. So it's definitely reversed his body's aging over the years of how it's functioning. And many of you have seen Dr. Ulin, and you've seen pictures of Dr. Ulin in his youth, or back in the early 2000s. It doesn't look like he's aged at all. Thank you very much, Edward, for the product line that you're going to be discussing.
Yeah,
exactly. A lot behind Dr. Ulin and his brilliance. My products are only a small component. I mean, he's got a whole science behind him that you guys well know.
Exactly, exactly. Now, which bring up an important point, right? And which is Dr. Brett, obviously, you may want to remind to all our students, but also there is people that maybe they are not students of nutrition response testing here because we send the invite to a lot of people. But maybe you want to remind to our students and how, that obviously they need to follow the standard procedures, our standard protocol of NRT, and it's not like a free-for-all, right?
Oh yeah, definitely not a free-for-all because we have discovered, or Dr. Ulin discovered, I don't know how he figured it out, but he's brilliant on this. He figured out that the body's autonomic nervous system gets stuck at some level, and if you don't get it unstuck, which we call block from working, the body cannot accept the supplements in the first place. And he also discovered that maybe the autonomic nervous system is not blocked, but it's in a state of confusion, which means the supplements you would take will have an opposite effect of what you anticipated. And then he's also discovered there are 6 environmental stress factors that can overwhelm the body. So you got to get all those factors lined up. You got to get an autonomic nervous system that's open for healing and not in a state of confusion, and identify any of the 6 common environmental stress factors that could be overwhelming the body. Now we can start to feed the body some good nutrition, which this product line is right at the top of my list.
Totally. So anyways, just simply as a reminder for all the nutrition response testing practitioners that are with us today, obviously do follow the standard procedure. Obviously, this is just one tool on your toolkit, but this is a very important toolkit, and we want to remind you how to use it, but obviously do the standard procedure. Now, for anyone else that is not trained on nutrition response testing, this is not just, you don't need to be a nutrition response testing practitioner to use this product. Nevertheless, you're welcome to be here with us today, but you're welcome also to check out Union Nutritional System and get more information on nutrition response testing in case you're interested to learn more about our system and our protocol. Moving forward, Edward, so you touched upon the point of the difference. There is a difference between the 3rd generation and the 4th generation of this product. Do you want to kind of expand upon this point so that our practitioners and they understand this point?
Absolutely. Early on, you guys were educated on the 3rd generation of products, which if you're using the 4th generation now, you'll see there's typically 3 major changes. Some of the product lines in the Cellular gain, which is what the base of UNS uses, have been either incorporated into one or completely removed. Adrenal is something that used to be very popular amongst the group, and now it would fall under the human cytocell and the endocrine formulas, as an example. Where before we had pancreas and stomach and intestines, now we have a digestive that has liver with pancreas, stomach, and intestines, all in one for the system. We used to have a pulmonary, and now you have the 3, which is pulmonary and cardiac. These are systems that play together, and we want to reinforce them together, was the thinking behind this. The other major difference was peptides in all our formulas. And when I was in symposium back in October or November, was it? November.
Yep.
We had a bit of a lagoon with the group about peptides, and if I could take a minute to kind of explain this to everyone,
Yeah, please.
I think it would be a key fact. The 3G process of our products had cellular extracts. These are long chains of amino acids or cells extracted from the sheep. But just visualize it. This is a long chain going into a cell. What are the biopeptides that we've been able to extract in the 4th generation? These are 20 amino acid chains or more, or less, that can go inside the cell and target specific sites. These are active sites to trigger functions within the cell that these long chains of cellular extracts were unable to do before. So it's become a more precise cellular nutrition thanks to these smaller peptide link chains. And what they do is they put them together in sequences that we know will help the cell thrive and be more functional. The fourth addition to the product was NAD in our human ultracell. NAD is an incredible product because it is anti-aging. It helps repair DNA. It reduces oxidative stress, regulates your metabolism, produces energy. It's just a combination of everything the cell needs, and it just propitiates the power for the cell to thrive. There was a question earlier before I got about what form of NAD we use. We use the nucleotide, the MNN, which is easier for the cell to absorb and then becomes into the NAD plus that the cell will use. Those are the three biggest distinctions in the new line. And if they have any questions for me to elaborate on, I'd be more than happy to.
Sure. Okay. No, that's very good. That's very interesting. And I think you already cover you mentioned one of these questions. I think it was from Frank King. Going more into do you want to cover, I think you touched upon a little bit, but do you want to cover a little bit more about the point of the stem cell versus what are the stem cell derivative? Do you want to expand upon that concept a little bit more? Because also that was something that we wanted to bring everyone up to speed.
Okay, when we talk about stem cells, there's a lot of things out there. There's autologous stem cells, which are where they extract from your fat and they centrifuge and they inject. You'll see that being offered a lot. There's PRP, where you take your plasma and they inject into joints. They're doing a lot of stuff with erectile dysfunction and hair loss with this area. There's also nowadays you'll find replicated cells that they'll take cells and replicate them and inject them into the body. And there's also naive cells direct from the core. Our cells are extracted from sheep. Our cells are derived from sheep, which are 99.9%, as we know, the same as human beings. And they take the amino acid chains and break them down through hydrolysis. We do an enzymatic process, and we reformulate them to mimic chains similar to what the human being uses in their body. And then these cells will go in the body and regenerate your cells, revive the dead cells, stimulate production of cells, and it will also have one key factor that we need to be very important with. It respects the nucleus. So with our line, we're doing the help, we're nurturing the cells, but we're not invading the nucleus, which is where replication and mutation can occur. And this can cause many diseases that we well know, cancer to be one of them, and other degenerative diseases. And that's what kind of is so incredible about my products. We're able to revitalize the cell and regenerate the cell without having any of the negative feedback that could come from cellular therapies.
Wow, yeah, that's amazing. That's well, I mean, that's also the reason why BioPharma is being in business for so many years, since the beginning of the century, right?
Absolutely. 1954 we started.
Right, exactly. That's awesome. That's awesome. All right, so now I'm going to take up some questions that actually came from the attendees. One question is from William. He was asking, I think you touched upon a little bit, but sources of the peptides. Then he was, I mean, you already mentioned that, but also say what tissue, amount of peptide in the struct tissue, synthetic recombinations, and so forth. I don't know. I mean, I think you already kind of covered this. I don't know if there was anything else you want to
I can
about.
generalize for Frank that we use ovine sheep. That's where we extract our cells, and we use enzymatic hydrolysis. I would like to direct him to, I mean, this is very scientific, technical, way above my expertise in biochemistry, but it's there at our R&D section of BioCellUltravital.com. if you go to our research and development section, and there's going to be a section that actually says how the biopeptides are derived, and it'll go into the full explanation to any level that you would want to know. Like I said, it's broken down through enzymatic hydrolysis, and then they put them back together. But aside from that, the biochemistry just escapes me right now. It'll be there for everybody that wants it on a more broader spectrum.
Great. I appreciate it. Thank you. Now, there is another question came from Martha at Stephen Creek Chiropractic. She was asking, we are eager to find out more specifics about the product, especially for menopausal women who are having weight loss issue and muscle joint issue. Can you cover this point?
Well, the beauty of what you guys at UNS and Dr. Yulin was able to put together is that you guys don't have to speculate like the rest of us do in medicine. You guys know what the body needs and can attack. For the case she's talking about, I would go to 4 basic tests of our products. I would test first for human ultracell because of what we've covered. It's just broad spectrum and it will help with everything. Then I would also check for the cellular gain number 4, which is osteoarticular, because when we suffer with menopause, we might have some bone becoming less brittle, bone becoming brittle, calcium deficiencies, and all that. So I would definitely test for that. I would test for the endocrine formula, which is H-Cetylplacel, because we're talking about weight loss and loss of muscle mass.
Yep.
This will help. It has precursors to hormones that the body might be needing at the time, and they will help the body generate their own hormones instead of hormone replacement, which is so state of the art, so in use now and in style now for hormone deficiencies. And then of course the stellar product there for biofemin is for menopause. That'll quell all of your symptoms, your hot flashes, your irritability, your low libido, and it'll take care of all that. This has been a game changer to many practices. That's feedback I get all the time. Women changing their lives with this product. Many times it's a practitioner herself calling me, telling me, why didn't you tell me about this? I'm in menopause now and you've changed my life. I'm like, well, and then your husband must be happy, and I'll joke with them or whatnot. But it's really the way to go first. Biofemin, and then the other 3 to see if we need to counter, excuse me, specific other actions within this this problem that we're dealing with, aging.
Right. Totally. No, that makes total sense. I appreciate it. Now, Dr. Brett, like I know that you need to take off a few minutes early because, I want to apologize for our attendees, but Dr. Brett is super busy and he actually have another Zoom meeting to go, another class that he's teaching at 1 o'clock. But do you want to say a couple more points you want to cover before you take off in terms of because I know also you're getting questions from our students about this product. So I don't know if it's something that you want to.
Yeah, I got a couple of questions here I'd like to answer. Somebody says, can you clarify what kind of stem cells are in which products? How do we get more printed material on these products? Client education, handouts, protocol dosing, etc. So Laurel, this is in your ACT7 manual. It's already there. And if you have any other questions, just email me on the clinical email line. And no, you do not need a new test kit since 2023. So that's the test kits were updated about then. And then Lambert, no, it doesn't have to be taken with food. In fact, read the blurb sheet that comes in your package with the thing, and some are taken with food, some are taken away from food. So you just have to read which is which.
Great.
All right, so.
Awesome. Okay, so
I'll just remind everybody that if you have clinical information, whether you're a nutrition response testing student or graduate, or whether you just are out there helping people with nutrition, you can always get a hold of me at the word clinical at unsinc.info, and I'll be happy to help you with your patients and answer all the information I possibly can. Well, that's about all I have to say, Daniele. As you know, yeah. I got to rush over and start my meeting now.
No problem. I appreciate it. Thank you.
You're welcome.
Thanks, Dr. Brad. Have a
Thank
good
you.
day.
Thanks, Edward. I appreciate you coming on.
Always a pleasure.
We go back a way, so it's good to see you again. Ta-ta for now.
Absolutely.
Yeah, exactly. All right. So, Edward, great to that you're still here. So, well, let me ask you one more question. I think somebody had, this is actually Diana at the Abundant Life. He had a question, say, I have 2 boxes of Ultracell. Does one take 1 box, the 3 weeks regimen, and then wait a month to take the second box? Or do they take them one after another? Do they 1 box, then start the second box right away?
Excellent question, and one I get often here at the office.
Yeah.
Human Ultracell and all our products in oral form, since they're not injected, continuity is key. 1 day off from the product will set us back from all the progress we're doing because we need to sustain the cells in the bloodstream so that they get to the cells constantly. Human Ultracell, it's not 3 weeks, it's 2 weeks per box. You take it continuously, 5 days of cycle 1, followed by 5 days of cycle 2, followed by 5 days of cycle 3. And then you would repeat it for the month, 30-day cycle of the Human Ultracell. Now, that being said, that's how it was intended. We have an advantage here at UNS that you guys can test the body and see if the body is still testing for it and whatnot. So what I recommend you do, since it is a costly product, and I understand that, is day 10, test the patient and see if he needs to continue. And if not, you can take them off and then adjust with other supplementation. But if they're still testing for it, you want to make sure on day 16 they're starting cycle 1 again. Because if not, we're losing the continuity of this precious product. Now, if we're doing it for the cellular reset or anti-aging purposes, preventive purposes, there it's the same thing. We just take 30 days continuous, cycle 1, 5, cycle 2, 5, cycle 3, 5, repeat. The beauty of this product is it comes in individual vials, so that's our daily dose. And many times people ask, do I take it in the morning? Do I take it at night? It's up to the practitioner. I prefer taking it at night. Why? Because a lot of people have the parasympathetic response you guys talk about, and they'll get tired and whatnot. And when that sets in the early stages of the product, they're sleeping through that, most of that, and then coming out awake in the next morning, being able to function better. But it's at the discretion of the practitioner. We prefer it not get bogged down in digestion, because the more it sits in the stomach, the more the acids can attack it. We have enteric coating to prevent that, but why risk it? If we can get it into the system 30 minutes before digestion or 2 hours after eating, we'll get it to the small intestine quicker, and we'll have full absorption of the product and the full benefits of the product. I hope that helps.
Yeah, absolutely. That'll make total sense because plus, I mean, if you go to sleep during the sleep, that's the best time for the body to rebuild and repair and all of that. So, but again, the description of the practitioners. So there you go. Okay, so I see here, Lori have a question. Say, can the Ultracell be combined with the specialized product at the same time?
My preference is, just from a cost perspective, to put the Ultracell first and then attack the individual problems. The only place I would make an aside for that are 3 of the line. The hormonals, the androcell or biofemin, because that'll help with the symptoms they're feeling from these processes. The detox therapy, if we know we have underlying heavy metal or toxins we're dealing with, we want to combat those right away because the product will help better. And anti-inflammatory. If we know we have a highly inflammatory process, we can help adjust the NAD levels, which will help with anti-inflammatory responses with some bioenzyme. and we'll get there even quicker. But the cellular gains, I would stay away while we're on human ultracell until we're ready to attack those individual issues. If they're testing for human ultracell, that would be true to human ultracell.
Awesome. Appreciate it. Thank you. I have one more question because nobody asked right this moment, but I know that is a subject that came up before, which is sort of the big elephant in the room, the price of this product, right? I may understand there's a lot of our practitioners are not used to this type of price or to present this type of price to our people if compared to other products. However, and you have a lot of experience on this as well, but do you want to cover a little bit of like for people maybe not necessarily are in the field of stem cell or so forth? Do you want to share like a little bit of a price range of like if somebody want to do injectable, what that would cost to do so, and versus because when you compare the injectable or people going out there to do some stuff with stem cell, I mean the price is like here and here, right?
Inside the United States, for a minimal treatment of stem cells, you're talking about $7,500 an hour. And that's minimal. The basic 200 million cells or whatever would run you in the 12,000.
Right.
Going to Switzerland, going to Latin America, anywhere, that's what we're talking about. Every 2 to 3 months.
Exactly. Totally. Yeah, and then also just from my own experience, like more from a marketing point of view, all of you need to realize the following is the fact that well, stem cell injectable, like you not only cost more, but also you have the whole additional expense and of a protocol that will, unless you are a trained or licensed person to do injectable, well, you cannot even offer. And the advantage, yes.
Excuse me, Daniele, it's something that's very limited in the United States too, as to how many cells you can give. 50,000 cells, I think it's capped off at. That's not beneficial. We want millions of cells when we have live cells to even start seeing some change in some aspect of it.
Right. So just on that point alone, like if you want to take the human ultracell, one box of human ultracell, I mean, obviously it's not the same. It's not apple for apple, but if you can do a comparison, like how many you will have on a box, type of things.
How many what of the cells?
Yeah.
I really don't have any way to tabulate that because it's more of when they inject it in vitro, they isolate the cells and whatnot. I can tell you that, I mean, it's the closest thing to live stem cells that you can offer on the market today.
Right.
I've been at the company 10 years. I know my competitors. I know, and nobody can touch this product.
Right.
You guys are offering the best of the best in this line.
Totally. Yeah, but again, kind of there is an important sort of point that I want to remind everybody, which is the following, is because this is in a capsule format, is the key point where you can basically offer this sort of protocol in this format, even though you are not, without the injectable, without having to use like a train, nurse or something, because I do know med spa that they need to have they need to hire specifically a nurse to be able to come to their med spa and
Nurse practitioner or doctor, not just a nurse. It has to be a nurse practitioner.
That's right. That's totally fine. Exactly.
Since you mentioned protocols, I'd like to mention to the group that last year we were in Forbes magazine, and BioCell did have a working relationship with Integrative Cancer Care in Switzerland. And part of Dr. Ben Pfeiffer's protocols for cancer, he's implemented a human ultracell and cellular gain number 6 for the immune system. And if anyone needs those, I believe you guys have them. If not, they can reach out to us and we'll get them to them. The different protocols that the Integrative Cancer Care Institute is using in line with BioCell to help with cancer patients.
Wow. Yeah, that's very good. That's very good. Awesome. I appreciate it. Well, that was amazing. Now, before we end off, okay, so I want to pull on our screen. Let me see if I can make it happen. We want to remind you that we have you can have this product on our store. Okay, so we want to drop the link for that. And let's see here. We have a little offer that you can use. Let's see, 1 second. Let's see here. Of a technical point. Let's see if I can get it. Off you go. Here we go. So yes, so we have a live podcast special for all of you. So we have an offer if you buy only 1 or 2 bottle or boxes, I guess, at $276, or if you buy 3 or more, $261. The normal price that you can resell it is $470, so it is a good margin there. And yeah, this is a limited offer as a part of the live podcast. So again, 1 or 2 bottle for $276, 3 or more $261. I think this is an awesome offer. You have plenty of benefits with this product, and I think it's an amazing opportunity for you to offer to all your patients, and obviously following all the procedure. And yeah, so I think we have the link happening that is on the chat, I think. And so there you have it. So all right, so otherwise there you go. So Edward, well, it was always a pleasure to have you here.
Oh, mine. I love meeting with you guys. You guys always bring great energy and fulfillment to my life. Keep up the good work, guys.
Yes, absolutely. Well, it's always a pleasure to see you, work with you. Like I mean, you guys are real team players, and always with us, working together with all the products that you guys have. It's always amazing, and it's always a pleasure. So if we well, I mean, we ran out of time, so I know that your time is precious, so we don't want to take too much. I mean, we get to stay here for hours. We would love to do that one, but in any case, if for whatever reason you have some questions, please feel free to email to us, clinical@unsinc.info. Dr. Brett would be more than happy to answer any clinical questions. If you want to order our product, you can go to the link, or you can call our main receptions, and our store staff would be happy to assist you and answer any questions, additional questions on discount or packages or all of that stuff. All right. So again, thank you, everybody. Edward, thank you so much.
Thank you. Have a good night.
Yes.
Have a good rest of your day.
Yes. Okay.
Take care.
Bye-bye.
Bye.